Hi everybody, it's Lori Brown from empowerednurses.org, and I'm really excited today because I have a very special guest, Carmen Kosicek. And Carmen is a registered nurse and a nurse practitioner, and she's been a serial entrepreneur. She's really quite amazing, and I'm so excited I get to share it with her today. And she has some issues she wants to discuss with nurse practitioners. But first, welcome, Carmen. Thank you so much for being here.
Hey, thank you so much. Hi, everybody. I'm really excited to be here with you, Lori.
Awesome. So you have such an interesting background. Could you share it with our viewers?
Absolutely. My first degree was in nuclear medicine, which is absolutely function testing at its finest. I learned a lot of things, and it really compelled me to do more. So I went back to school. I became a nurse. In nursing school, I hated it until I ran into labor and delivery, which I absolutely loved. And I said, I want to be a nurse midwife. Jeepers, that was like 20 years ago. I feel I'm only 46, but over 20 years ago, hardly anyone was really in these advanced practice roles. So I promptly graduated with my MSN, started working in labor and delivery, and did what everyone told me I couldn't, which was go back to school right away to become a provider. So I went to Case Western Reserve University, which obviously is a huge medical school out in Ohio. And then that's where I picked up my MSN. I went down to Mary Breckinridge's school from, why not have iconic nursing, right? Women on horseback delivering babies. That's what we did down there. And I became a nurse midwife and realized how horrifically awful the climate was for advanced practice nurses because I lived in Illinois and the AMA was based there. So I decided to work inside of pharma. So I went and applied, and it took me like 7 times, and Wyeth, a big women's healthcare company, wouldn't take me because they were worried that I was too clinical. So I interviewed at Pfizer, the largest drug company in the world, and nailed a spot after 2 interviews. I stayed with Pfizer for 8.5 years, started off in sales, ended up doing clinical nursing for them in psychiatry and neurology. When I was downsized in the recession, thank goodness, I had always been teaching part-time as an adjunct professor. But I went into the nursing world and started up nursing colleges around the country for the second largest for-profit system, which at the time, it's now been closed and downsized, but obviously the first largest is University of Phoenix. I was at the second largest, which was Corinthian. Then after being downsized again, I went into the insurance world by default because I wanted to learn about that, and I became a supervisor of utilization review at a company called Molina, one of the big HMO Medicare Medicaid plans in the Wisconsin market. After that, I said, I'm going back to school. Not that I wanted to go back to school, but I decided to go back to school to be psychiatric mental health nurse practitioner. And I started a business after realizing how little the pay was in the Wisconsin market. And truly, since I understood my worth, I said, I need to go back. So, and start my own business. So, of course, I've written many books. I've written for multiple millions of readers for nursing journals and such, and little things along the way. Is that a good way to say that?
So what books have you written?
You can find me on Amazon or Barnes & Noble's under Nurses, Jobs, and Money. Okay. The next one is Nurses. Oh, that won a huge award. I was so surprised because I'm not like the kid in school who said that they love to write. That was not what I said. So I wrote Nurses, Jobs, and Money, which is now continuing education on demand series powered out of Altus Learn and marketed nationally, backed by UW Wisconsin. And then Nurses, Jobs, and Resumes. I have 2 other books that I sincerely just haven't had time to finish, but that are ready to go. Nurses, Jobs, and Education, and foreign educated nurses on how to come to the U.S. to serve in our underserved markets.
Oh, wow. Fabulous. And then your latest venture is Alay Health Team.
Correct.
Right.
So Alay Health Team is the psychiatric mental health nurse provider team that I've put together online and on site. We are a clinical teaching institution here for colleges across the country like Rush, Gonzaga, UC, Texas Tech, University of St. Francis, UAB, you name it. We've got the schools coming in from across the country. We teach FNPs during their specialty rotation. We also do a lot with addiction, whether it's Vivitrol or Suboxone.
Mm-hmm.
So we also hire CNMs, women healthcare nurse practitioners, and FNPs to additionally help with this opioid crisis, as well as our PMHNP team. We are 100% prescribers. We have over 45 access locations so far. It's really 65. I didn't list them all yet, but 45 sites throughout Wisconsin where people can telepsych and have access to psychiatric prescribers. And I built this business to truly showcase the role that nurse practitioners can do. And now that I've been doing this, I'm running into a lot of issues that are out there that I sincerely don't believe nurse practitioners realize, because if they don't have their own business, they wouldn't know such things that I unearthed. And that's why I called you, Lori.
Okay. So I think it's beautiful because you found a need and you figured out how to fill it. You knew that Wisconsin was very underserved in the psychiatric services. In fact, I know in Indiana, our medical schools only graduated 2 psychiatrists. I believe it was last year or the year before, and that's it for the entire state. And that's just awful. So you found a need that how important it is for nurse practitioners to help in these underserved areas and these areas where there aren't enough physicians. And now in Wisconsin, you still have collaborative practice agreements, right?
We do. And just for full disclosure, Lori was the nurse attorney that we hired to help with a lot of our documents. But yes, Wisconsin is currently listed per the Kaiser Foundation, the second state in the nation. However, the disparity is just out there everywhere, like what you said, only graduating 2 psychs. And so in Wisconsin, currently, it's the end of 2017, under Wisconsin law, you have to have a collaborating physician to be a nurse practitioner. However, that collaborating physician can be any kind of physician, as long as they have an MD or a DO. What's really interesting is under the law, so I'm new to Wisconsin. We moved here to start this business. We wanted to get out of Illinois because it was so challenging with the AMA there. Mm-hmm. So we moved up here, and a lot of my contacts were in Tennessee. We'd lived there for 2 years, and then in Illinois because we'd lived there. So I had collaborating physicians in those states, which met the Illinois law, saying that you need a collaborative physician of any kind. It did not have to be a psychiatrist, which, just for the record, to me, makes no sense.
It doesn't.
But hoop jumping at its finest.
Yeah.
Right. So we did meet law and have collaborating physicians. I have multiple collaborating physicians because, this is not my first dog and pony show. And I know what happens to nurse practitioners a lot is the political pressure that's put on the collaborating docs when the nurse practitioners get busy. So I've made sure to protect my, work, which protects my family, that I have multiple collaborating physicians. However, even though I met the law, and even the medical malpractice companies agreed that I met the law, the payers, so the insurance companies, when I went to go get my insurance contracts, said, yes, we know that that's the law. However, we, Blue Cross Blue Shield United, whatever, as an example, said, no, we want to make sure that you have a collaborating physician in Wisconsin. Again, didn't matter the type of physician. Well, that gets down to a lot of this then, because then if you don't have people that you have to pay for a collaborating physician. That's very common. Yes. A lot of people will ask how much. It depends on how many full-time or FTEs that you have. So an average going rate for 1 to 2 FTEs for one provider to back them, so one other physician to back them as a collaborating relationship, which, by the way, does not mean here ever. My collaborating physicians don't have to come here. They never have to do chart reviews, and they don't have to sign on anything. Mm-hmm. Many of you would say, what are they doing? And I gladly pay my $500 a month for my status of 2 FTEs, which is considered a good, fair price. Some people charge higher. I gladly pay that just like I do for my term life insurance. Mm-hmm. I to use my term life insurance soon, but it's one of those bills that you have to pay. I know people will say they're not doing anything. If I didn't have them, I wouldn't be able to have a business.
Right, right. So now talk to me more about what you're doing about how to go around getting the providers to credential you.
So that's really interesting, and that's why, being frontline in the fields of seeing what's happening, that I actually reached out to you. So of course, I totally understand all the data with how short it is of not having enough providers in psychiatry, and I really didn't think that this would be that challenging then to get credentialed on insurance. So when you go up to get a new insurance plan, it takes about 6 to 9 months from the time that you apply for them to actually grant you a contract. Mm-hmm. So that's just the process. So when you go to apply, you ask if they need psychiatric prescribers, which to me is just like a silly question in the second shortest state in the nation. Yeah. I have been now turned down by 3 plans, 3 different plans. Well, no, frankly, we don't need any more. We're okay. Yeah. And I'm like, you lie, like, there's no way that you're okay. And so I challenge them and I say, do you understand I'm not a therapist, counselor, social worker, or psychologist? Do you understand that PMHNP? Do you know what that means? I am not a family nurse practitioner. I am psychiatric mental health. Do you understand what that means? So, of course, I send them all the data.
Yeah.
And then I still get, no, need any. And I say, do you need a psychiatric physician? You're telling me you would not. Nope, we're good. And again, I say to myself, they lie like a rug. Yeah. Because how could they not need, especially since addiction falls under psychiatry in the scope of medicine. I'm not saying I practice medicine. I'm saying like men on earth, although I'm a woman, but on the scope, that's where addiction falls. So how could, in this crisis that is facing our nation, how could you not need me? Now, my personal belief, which is just my personal belief, is it makes me wonder if they don't want to pay my claims because, of course, I can code like a specialist. PMA fully codable to a psychiatrist, which means we can add on psychotherapy in addition to our EM codes, which is why so many people are clamoring to work in psych because you can see less patients per hour and still make a decent income. Fields as a nurse midwife or an FNP or something like that, you still need to see a crazy volume of folks, easily 5 or 6 in an hour, to only bill for those EM codes. And so when I was
reimbursement less for a nurse practitioner than a physician, it's like 80%, right?
So what happens nationally, there's only one state that has the law, that's the Oregon Parity Law out in Oregon. They are paid 100% equal. But in all the other 49 states and territories, it's a negative 15% hit off of CMS guidelines. CMS is Medicare and Medicaid, for those that don't know, and CMS guidelines is what showcases to commercial payers on what to do. Is why I called you, because I need people to understand what's happening. Yes. I was turned down by 3 plans. 2 of them were CMS plans, which means they take Medicare and Medicaid, and they're the HMO products. What drives commercial is CMS. So if CMS is allowed to deny me, and my question was, is that misappropriation of federal funds? Because the government gives the state, and then the state delineates down from there. If they're allowed to not have PMHNPs and to allow FNPs, which is clearly out of scope under any of the Barkley review courses or anything else that you were look up or under, oh, Lori, I sent it to you now. Just passed my mind. The nursing, the big kahunas in nursing. I'll think of it. Where the nursing boards are saying you must have, it's delineated. It came out in 2008 with full implementation by 2015. You must have 5 different ones: CRNA, a CNM, a PMHNP. I think it's neonatal, and there's one more. But you must have, under these nursing regulatory bodies, you must have this certification because the schooling and education is different along with the residency. So when I'm in Wisconsin seeing such things of getting denied, it really makes me very fearful for the rest of the nation as what's coming then under commercial plans. Right. Because that would be as ludicrous. as, no different than in medicine. If I had a pituitary tumor, I wouldn't see a podiatrist, although they are a surgeon. I also didn't see an OB-GYN to have that taken out, although an OB-GYN is a surgeon. Instead, I would go to a neurosurgeon. It's not a war of nurse practitioner against nurse practitioner. That's not what it is. Right. It's about making sure the nurse practitioners are safe. Because I pulled the medical malpractice from the payer of the medical malpractice company, MMIC, flat out told me, you cannot have FNPs working at psych because it's out of scope and they will not be protected in a court of law. Interesting. So other things that are very interesting is Wisconsin is one of 13 states where the physicians' lawsuits are capped. So I have nurse practitioners telling me all the time, well, I have a job over at XYZ hospital or great that you have a job. I'm telling you, if you pulled your medical malpractice, you're not going to be covered in a court of law because what you're doing is considered out of scope. It would be no different than the podiatrist thinking, because he or she is a surgeon, that they could take out a brain tumor. Right. It is absolutely no different. It is not a war on nurse practitioner to nurse practitioner. Instead, it's, I want you to be safe. If you will get sued, they are clocked. Everything that you have. You can be sued against potential future earnings, as we know Edie Brown has showed us. And you need to be careful because they're telling you to jump off a bridge. And you're just so happy to have a job that you said how.
Right.
They understand.
Yeah. And I've had an issue with a nurse who was concerned about her license, who was hired in as an FNP, and even though the job description was more for a psychiatric mental health practitioner, and she didn't want to do some of the things that they said, even though there was full disclosure hiring her in. So just be careful. Don't practice outside of the scope. Your license is too valuable. If you get sued, hopefully insurance will cover it. But like you said, if you're practicing outside the scope, the insurance company does not have to cover you. But your license is too valuable. So don't work in an area that is outside of your expertise.
And I think a lot of people would falsely believe that it is in their expertise, because in regular nursing school, be it diploma, associates, or baccalaureate, they did have a psych rotation. In their FNP, they did learn about psych. However, what we're speaking about is prescribing antipsychotics when you have never had neurobiology, psychopharmacology. You have never had, under the ANC, who's the only regulatory body for PMHNPs, you have never passed that certification. It is clearly delineated that you cannot bill for psychotherapy. And a lot of FNPs will say, well, I don't want to bill for that. It's not about the money. And I'm saying, you're wrong.
Yeah.
Pay for it because you're out of school. You don't have to do psychotherapy as a PMHNP, although I'm not sure why you wouldn't, but you don't have to. But the point is, it's that they're not able to because they don't have that certification. Even in loan repayments under HRSA or nurse courts, it definitely delineates that you must have to practice in psych a PMHNP. And so many will think that I'm trying to wreak havoc. No, I'm trying to save you all. You just don't want to have, like me, I also had to go back to school. I don't love going to school, but I had to do it in order to do this. And people will say, well, I learned on the job. I said, that's not going to hold up. That's not how it works. You didn't just get to learn how to drive on the farm and then go get a driver's license. You actually had to take a course and pass a test. And yet all the farm kids are driving by the time they're 12. It's just that these are the laws. There's a reason for this. And it's just how it works.
So even if you do have a primary mental health nurse practitioner, the insurance could be an issue, the credentialing. Is that what you're saying? Yeah.
Absolutely.
Yeah. In other states where they have collaborative practice physicians, like they have to be of the same specialty and in the same state. So, but you're saying even if you had a psychiatrist in Wisconsin, they still wouldn't credential you?
Which I do have. So on my team of collaborating physicians, one actually is a psychiatrist. However, the insurance companies, because they're paying fees out of scope, why would they want to pay when psych shows up? Why would they want to? So now the question, as you know, I've sent in a 67 inquiry page document to the Board of Nursing that they're question. The board said to me, well, we didn't know. And I said, well, I don't believe you because you approved nursing schools. So why then have you approved nursing schools for PMHNP? Clearly, you need to give all these people their money back and pay them for their time. The reason that you're doing this, now I remember the name, the Consensus Model of Nursing came out in 2008 and said you must do this. Yeah. And they're the big kahunas over all the boards of nursing. So really what's happening is still a lack of
National Council Board of Nurses. Yeah.
You still have a lack of education in where these schools, which let's be honest, they're the business of education, they're still telling everyone if you're an FNP, you can do everything. You can see everything, but it does not mean that you can do everything. It is no different. I just want to strangle people and go, are you not listening? That you have a family physician, and obviously physicians have way more education than nurse practitioners. They have more time in school, let alone their residencies. Yes. Then why would a family practice physician who's hiring the FNP not do psych, but FNP can? Because they understand under their license they're not covered. But I guess what flabbergasts me is the FNP will think that he or she can when a doctor of the same title, family practice. And I just really want to wake up and realize why they're asking you to do it. They have nothing to lose.
Right.
You do.
Yeah, exactly. It's your license. It's your livelihood. And if their medical malpractice carrier won't cover you, you're on the hook.
That's correct. And what have you seen in cases? What are you seeing about FNPs practicing psych if it even goes to a case? What have you seen as the attorney?
I do see FNPs taking these positions and then feeling it's outside their scope, and then they get frustrated, and their employer demands that they do something, and when your employer tells you to do something, you've got to do it or you've got to leave.
Yeah.
You can erase
and have you seen any losing cases like not doing well because they're outside of their scope?
I have not seen anything like that yet. But like you said, this is cutting edge. This is new. It's coming. And people in most states have like 2 years to file a claim. So let's go back to the insurance issue. You've talked to your legislature about this, right?
I've contacted, so I found out who was on the Board of Mental Health, and I brought this issue to them. They had no idea, and they also could not explain it. I had waited months. We had a contract with one of the big players, like United Healthcare, for example, and even though we've got the contract, it was taking more than 5 months to actually get me credentialed. So now that I've been pairing up with the legislators and the Board of Nursing, I send an email within a week. It magically got done.
So you're all good?
So I'm good with that, yes, but it parlays payment. And I think that's what people need to understand is although you're in states where there's such a shortage, please be mindful that it will take way longer than you think. Even though there's a shortage, even though it's very obvious that they need you, it's not as simple to land an insurance contract and then to get paid on these special codes that PMHNPs can code and go for, and should, because that's what we're rightfully allowed to do.
Right. So what advice would you have for a nurse practitioner who wants to hang their shingle in whatever specialty?
Absolutely. Rules of the Board of Nursing, but hire credentialer to get the insurance contracts, because you don't understand how to negotiate your rates. Please do not accept what they first offer you. Please do not. But learn how, to go and attack it differently. So rates I would keep the same and others I would not. And then how to positively position yourself with a little bit of peer pressure in a good way of showcasing why you're needed and what you deserve. Guess what others need the most? Any nurse practitioner is they're always saying, oh, I can get X, Y, and Z job for, X, Y, and Z amount of money. And my question is, well, how many patients did you need to see per hour to hit that. And then they look at me and they're like, well, I don't know. I just wanted the job for $100,000 a year, $150,000 a year, $200,000 a year. And that's why I took the job.
Right.
And I really would say to people, you need to learn a little bit of this. You're getting taken for a ride.
Right.
If you go at it that way, they're going to dump on you and you'll see 20, 30 patients a day.
And
or if you, that's not safe. And then instead,
I've
you
had a nurse.
learn how little. Go ahead, Lori.
I had a nurse practitioner who was working at a practice where it was high risk OB. She was seeing 4 patients an hour. Went to another practice and was seeing 6 an hour, and it was too much for high risk. It was just too much, and you know, she wound up before the board, and it's not worth it. You can always get another job. You can't get another license. So set yourself up for success. If you know, you can see only 4 patients an hour, find a job where you can see 4 patients an hour. They need nurse practitioners so bad everywhere. You will find the right environment. And if you want to hang out your shingle, it's not so scary, is it, Carmen? You grew tremendously in how long?
You can absolutely do it. I think it's important to be mindful and then to understand, just like the rest of the country, just like when you take your insurance, you don't pay cash to your provider, so you give them your insurance card. It's going to take 4, 6, or 8 weeks to have the bill returned. And guess what? The claim, and I would highly suggest a professional biller, through squeaky clean, and it might have to go back and be redone. So this is a provider position as an NP. Stop asking for it to be hourly like a staff nurse, because you will be less, you won't be paid what you're worth, and you're saying yes to many things when you do the hourly rate. Instead, understand, just like other providers, that this is a provider position and that it takes time to build a base of clients to come and see you, and then the payment is delayed because that's the system of how it works. And it's unrealistic to think you're going to have a full cash business unless you've already been practicing in that market as a provider. So even though you're in the second shortest state in the nation or wherever you are, it takes time, and to be realistic with the expectations, because it's definitely worth it. It does pay off. You can say no to certain clients. You can pick and choose what it is that you want to do. And I would also recommend that providers are new, that they build their base of experience really wide. Do not try to take the easy road, because then you're not as marketable for if you look for a job down the road.
Sounds great. Well, such sound advice. Do you take co-pays up front?
We do. So the office team has an EMR system that will even tell them these insurance deductibles, by the way, are usually outlandish. They're a good $5,000, $10,000 to where people are paying up front before the insurance kicks in. So you have to be mindful of that as well. So yes, although you're on their insurance plan, their insurance really doesn't do anything. It's catastrophic insurance.
Right.
Times are changing in the insurance arena. You have to be mindful of that.
And get the money up front, or you may not get paid.
You won't get paid. And then if you go after them in collections, whatever they do pay, you end up giving 50% of that to the bill collector. So you have to have staff. You cannot do this all by yourself. And then I think that's important for nurse practitioners to realize is, you might think, oh, look, get an hour, I should get paid $150. Well, you got staff to pay, you've got bills to pay to run the business. It's not that simple.
Right. Well, great. Any other advice you'd give to somebody thinking about starting out, hanging out their own shingle? I think it's the way to go. I think doctors made a big mistake when they started selling their practices to the hospital, because they lost all their autonomy, their independence, everything, and now they're stuck on the hospital schedule and who the hospital puts in their schedule, and as many patients as the hospital wants them to see. And I hate to see nurse practitioners make that same mistake. You have such a valuable service to offer.
I agree, and patients love it that we're not tied to the hospital's formulary. I'm tied to the formulary that insurance or the state insurance allows me to prescribe, which honestly makes me a better clinician. And I agree with you. Nurse practitioners should do their own business. However, I would make sure that they take business classes.
Absolutely.
I've had many business classes. I don't yet have a degree in business, but I'm probably not far from one. I just don't need to pay the money for the piece of paper. Take classes to learn about business, because sadly the business of healthcare is not yet being taught.
And my nurse practitioner business school starts in January, npbizschool.com.
Good. That's absolutely what they should take, because it's not necessarily that you need accounting. You don't need all the classes that the college will show you. You need to learn what to do and how to do it. So I would absolutely sign up for this class. I hope you have an on-demand one, or that's coming.
Thank you. Thank you. I'm going to do it live for a couple times just to, make sure everybody's getting their needs met. And my goal is to help people be successful. And that's what I do with legal nurses and other nurses. Yeah. So
outstanding.
Thank you.
Lori, thank you so much for all that you do. Being a nurse attorney is just so needed. And I would hope that more people recognize your name.
Well, thank you.
Are then understanding that attorneys are the ones who need to take care of the nurses.
Oh, thank you. I feel like I'm a nurse for nurses, but I'm always committed to giving you, my readers, the latest, the greatest, the newest, the most interesting nursing information that I can on whatever level. Nurse practitioner. To me, a nurse is a nurse. I don't see differences. It's just, we all came from the same mold, and we all want to improve patient care, no matter how we do it.
Absolutely.
Okay.
Yes, nurses helping nurses. I agree.
Well, thank you, Carmen, so much for sharing your information. Very interesting. Thank you. I appreciate it. And thanks, everybody. And we'll see you on the next call. Thanks.